Hello everyone! Welcome back again to my channel. So this is Nurse Annie again, and to those of you who are new here, welcome and thank you for tuning in. And if you haven't yet, please do hit that subscribe button and connect with us. So our video for today is actually the first of a series of videos I will be making about the common medical surgical cases that we cater or we admit on the floor. So this idea actually came into mind when a subscriber asked me to do a video on the common medical surgical cases that we encounter or we admit on the floor and the common medications that we give on medical surgical floors. And so I thought perhaps a video is not even enough to discuss only few of those cases. So I thought of doing a series of videos on this topic. However, just a disclaimer, what I will be sharing with you on this video and the succeeding videos on this series will just be based on my experience and the common cases that we admit on our floor and the common medications that we give to our patients. So of course, every institution has their own policy or protocols on what kind of patients they admit on their floor. So as I've said, what I will be sharing with you on this series would just be based on my experience and the cases and the medications that we encounter on our medical surgical floor. So what I thought of doing on this series is just like take a case of our own admissions on our floor, and that's what I will be sharing with you on this series. And just like, just take their presenting problems, their working diagnosis, the lab results, what are the common medications that are prescribed to them, and the treatments, the plan, the assessments, and all those good stuff. So that's what I will be sharing with you on this series. So if you are interested on this topic, then keep on watching. And also, please don't forget to subscribe and hit that notification bell so you will be notified every time I will upload a new video. So anyway, on this series of videos, I will only be focusing my discussion in the primary diagnosis of the patient, in the primary working diagnosis of the patient. I won't be going, over their comorbidities or any other secondary diagnosis if they have one. So we won't be going to one disease process to another, if you know what I mean. Okay, so the first case I will be sharing with you is, I think, the most common med-surg admission nowadays, the COVID patients or the pneumonia due to COVID cases. So these patients usually presents to the emergency department because of shortness of breath, either shortness of breath, weakness, persistent cough, diarrhea, fever, and the list goes on. Each has different presenting signs and symptoms. So in emergency department, of course, they will do the lab works, they will do the diagnostics, and usually for COVID patients, what you will actually notice is normal WBC, which actually it's supposed to be high, isn't it? If you have an infection, usually WBC is high. But for COVID patients, almost always their WBCs is normal. And of course, their CBC is insignificant. But the thing is, the D-dimer is almost always high for COVID patients. With high D-dimer, usually these are noted in patients who has DVTs or clotting problems, these kinds of patients. But surprisingly, D-dimer levels are high for COVID-19 patients. And of course, their chest x-ray would show pneumonia, infiltrates, either bilateral or only one-sided, but it always shows infiltrates, which is indicative of pneumonia. And also in the emergency department, they will also do a CT scan of the chest just to rule out PEs or pulmonary embolism. And of course, the ultrasound of legs just to rule out any DVTs, especially so if the D-dimer is elevated. So they will, do those diagnostics just to rule out any other problems the patient has. And of course, after which the patient would be admitted on our floor, on our med-surg floor. So you would expect that the patient would be on oxygen if their respiratory status is compromised. And of course, you would expect that with COVID patients, the doctor would be ordering for their diet because there would not be an indication for them to be NPOs. They would be activity as tolerated. Of course, if they will be on oxygen, respiratory therapist will be consulted. And of course, you would expect that the doctor will be ordering the COVID-19 protocol medications for these patients, isn't it? These medications includes the remdesivir, which is the medication of choice for COVID-19 patients actually. Of course, the vitamin C, sometimes vitamin D, the zinc oxide, of course, some form of nebulization or breathing treatments, which will be managed by the respiratory therapist. Of course, dexamethasone, if you have noticed that, they usually order that for COVID-19 patients. And of course, cough medicines, which is usually Robitussin or Tesalon or any other cough medications there are. And of course, there are also PRN medications for cough, which they add if they want to. And of course, you will be noticing that the doctor will be ordering some Lovinox or some form of anticoagulation therapy for these patients just for therapeutic purposes until the VTEs will be ruled out. So let's go to the nursing interventions for these patients with COVID-19. And of course, based on your assessment data, nursing interventions for COVID-19 patients should focus on monitoring their vital signs, especially their temperature, their heart rate. It might be elevated because of fever or their blood pressure, whatever is necessary that you will do to keep their vital signs, within acceptable range. You have to do that. And of course, maintain their respiratory function. Just be sure that they are hooked to oxygen if they need it. And of course, be sure to call the RTs for their breathing treatments or their nebulizations or whatever your hospital's protocols or policy on this are. And of course, if the patients are on BiPAP or on CPAP or any other form of oxygenation, you have to monitor this as well. And of course, managing their abnormal vital signs as well, especially, as I've said, especially fever. If they are feverish, you have to adjust the room temperature, take out extra blankets, any clothing that there is, or do sponge bath or help them to take a wash or something just to relieve their fever. And of course, in reducing the transmission of the disease, you have to follow or observe the precaution, the special airborne precautions that are due to these COVID-19 patients. And of course, don't ever forget to wash your hands, your hand hygiene. That is very, very important in eliminating the spread of these diseases. And of course, use your PPEs. They always reiterate this use of PPEs to these COVID-19 patients. So don't ever forget that. And of course, last but not the least, you have to educate the patient and the family members as well of the transmission of COVID-19. And of course, educate them with how they can protect not only themselves, but of course, the people around them as well. That is actually very, very important in limiting or controlling the spread of COVID-19 in our environment. Okay, so there you go with my video for today. And I hope you learned a thing or two about COVID-19 patients or what to expect if you will be admitting a COVID-19 patient on your med-surg floor. And if you did, please don't forget to hit that like and share button. And to those of you who haven't yet, please do hit that subscribe button and connect with us. So thank you for watching, friends, and see you again on my next video. Bye-bye.